to meddysimplified. In this video we will talk about Apgar Score. So what is Apgar Score? It is something done to assess the health and vitals of a newborn. Something which is done to assess the health and vitals of a newborn. Okay, so everything in this Apgar Score, that is A, P, G, A, R, is having some value. So there are some of the indicators. So A is for appearance, that is skin color. P is for pulse, G is for grimace, A is for activity, and R is for respiratory effort. So this is total Apgar scoring. So for each thing we have a pointing system, 0 point, 1 point, 2 points. So for each indicator we have 0 to 2 points. 0 is in abnormal, 1 is in between, and 2 is normal. So first for appearance, if the patient is blue, if the baby is blue, we call it as a cyanotic baby and we give it as 0 points. So for a cyanotic baby, 0 point. For pink baby, for baby with pink body and blue extremities, we call it as a partial pink, we give 1 point, and for completely pink baby we give 2 points. Now next is the pulse. If the pulse is totally absent, we give it 0. If it is less than 100 beats per minute, we give it as 1. If it is more than 100 beats per minute, we give it 2. Then next is grimace. So what is grimace? It is a response or reflex to any stimuli. So if the baby is giving no response, it's 0. If it is giving minimum response to stimuli like facial expression, we give 1. If it is giving prompt response to stimuli, that is a complete reflex or response, so we give it 2 points. Then we have last activity, that is the muscle tone. In activity we measure the muscle tone. If the muscle tone is completely absent, 0. If it is a partial flexion, we give it 1 point, partial flexion. If it is complete flexion, we give it 2 points. Then the last is respiratory efforts. So one more thing, there is a question every time asked in exam, that which of the following is not a criteria or indicator in Apgar Score. So remember, respiratory rate is never indicator in Apgar Score. It is respiratory efforts which we check. Okay, so if the respiratory efforts are absent or the baby shows no respiratory efforts, we give it 0 point. If it is poor, 1. If it is good, we give it 2. Or the baby is crying, we give it 2 points. So in all we have 0, 1, 2, total 10 points maximum, and 0 is the minimum point. So if the baby is having total 0.8 to 10, we give it as a normal Apgar Score. If it is 4 to 7, we call it as below low, it is abnormal, but below, we call it below normal. If it is less than 4, that is 0 to 3, we call it as critically low. We call it as a critically low. That is 4 to 7 is also low, but it is below normal and critically low. So Apgar Score is done at 1 minute, 5 minutes, and if there is a continuously low Apgar Score, we also do it at 10 minutes. So for the Apgar Score at 1 minute, it tells us overall status of the baby at birth and overall status of the baby at birth, and the Apgar Score at 5 minutes. After this we do resuscitation. Alright, one overall status of baby at birth. At 5 minutes we do resuscitation in between this. So this Apgar Score at 5 minutes will tell us about the effectiveness of the neonatal resuscitation. Effectiveness of the neonatal resuscitation. So this was all about Apgar Score. So once again, Apgar Score is done to assess the health and vitals of the baby, of the newborn, at 1 minute, at 5 minutes. Every Apgar Score is having 0 to 2 point, and the value I have already mentioned. Now let's take out a question in order to check whether whatever we have did till now has worth it or not. Suppose the baby is having no respiratory efforts. Second, giving minimal response to stimuli, that is grimace is minimal response. Heart rate is less than 100 beats per minute. And the baby is completely pink with extended limb. So what we need to do, we need to calculate Apgar. Alright, so let's count the Apgar Score in total. That is, no respiratory effort, we'll give it as 0. Baby is having minimal response, 1. Less than 100 heartbeat, 1. Pink body, 2. Now it's written extended limb. In this activity we will never mention about extensions. So we'll calculate as a no extension, no muscle tone, and the total is 1 plus 1 plus 2, that is 4. So the Apgar score is 4. So once again, Apgar score done to assess the health of the vitals of the newborn. At 1 minute, it tells the overall status of the baby. At 5 minutes, it tells about the effectiveness. So A, appearance, P, pulse, G, grimace, that is response to stimuli, and A is activity, we check the muscle tone. Remember, extension is not measured in this. Then we have respiratory efforts. Respiratory rate is not indicated in Apgar score. Then we have we calculate it. If it is 0 to 3, we call it as critically low. If it is 4 to 7, we call it below normal. If it is 8 to 10, that is more than 7, then it is a normal Apgar score. So this was all about Apgar score I want to discuss about to you. Thanks for watching the video. Please like, share and subscribe my channel Meddysimplified. Thank you.